You wake up and something feels off, not just tired but truly strange. Maybe your hand is numb, or you feel dizzy, or your words come out jumbled. It's easy to blame these on a bad night's sleep or dehydration, but these odd moments could be urgent messages from your brain. Think of them as your body's alarm system, warning you about a problem with blood flow to your brain. Ignoring these signs is a gamble. Numbness, confusion, or sudden weakness aren't just minor annoyances. They could mean your brain was briefly starved of oxygen. We're used to pushing through discomfort, but neurological symptoms are different. These aren't just aches or pains, they could signal a vascular emergency. A moment of weakness or double vision that passes shouldn't be ignored. These are warnings that demand immediate attention. Recognizing and acting on them is the first step to protecting your health. Don't dismiss the whisper, listen before it becomes a shout. As a neurosurgeon, I've seen too many patients who miss the warning signs. I hear, "My vision went blurry, but it came back," or, "He had trouble speaking but we thought he was just tired." These aren't stories of neglect, they're stories of hope and denial. The tragedy is that the first event was the golden opportunity to prevent disaster. By the time a major stroke hits, the damage is often done. I remember a patient who ignored a limp arm for 5 minutes. 2 weeks later, he suffered a massive stroke. These brief spells are emergencies, not minor glitches. The best outcomes come from recognizing and acting on small warnings. Don't wait for a catastrophe. Act on the first sign. The medical term for these warning events is transient ischemic attack, or TIA, often called a mini-stroke. It's a temporary blockage of blood flow to the brain, like a brief traffic jam in a vital artery. Symptoms, numbness, weakness, trouble speaking, appear suddenly, then vanish as blood flow returns. This quick recovery is deceptive. It creates a false sense of security. A TIA is not harmless, it's a serious warning that something is wrong. The same conditions that cause the TIA can cause a major stroke. A TIA is a near miss, not a minor problem. The only mini part is how long it lasts. The risk is major. Treat a TIA as a medical emergency, just like a heart attack. The goal is to find and fix the cause before a catastrophic stroke occurs. Don't ignore a TIA, it's your brain's urgent call for help. Recognizing a TIA starts with knowing the symptoms. They're identical to a major stroke but temporary. Sudden weakness or numbness, especially on one side, is a classic sign. Facial drooping, slurred speech, or trouble understanding words are red flags. You might lose vision in one eye, see double, or feel dizzy and uncoordinated. These symptoms can be confused with sleepiness or fatigue, but their sudden onset is key. If you can't lift your arm, your smile is uneven, or your words are garbled, act fast. Remember fast. Face drooping, arm weakness, speech difficulty, time to call emergency services. Don't wait for symptoms to pass, get help immediately. Quick recognition can save your brain. Share these signs with loved ones. Acting fast makes all the difference. The most dangerous thing about a TIA is how quickly symptoms disappear. You might feel weak or confused, then perfectly normal minutes later. This rapid recovery tempts people to dismiss the event, but feeling fine doesn't mean you're safe. The underlying problem remains. The TIA is the fire alarm, not the fire. Ignoring it lets the real danger smolder. Many avoid the ER, fearing they'll be told nothing's wrong. But the risk isn't over when symptoms fade, it's just beginning. The real threat is a major stroke in the coming days. Treat a TIA based on what happened, not how you feel afterward. Seek immediate care to find and fix the cause. The emergency starts when symptoms vanish. Don't let relief turn into regret. The risk after a TIA is real and immediate. About 1 in 3 people with a TIA will have a major stroke within a year. The highest risk is in the first 48 hours. Half of follow-up strokes happen then. That's why a TIA is a medical emergency. Waiting even a day can be dangerous. Doctors use tools like the ABCD2 score to assess your short-term risk. High scores mean higher risk and may require hospital admission. But every TIA signals urgent danger, no matter the score. These numbers aren't to scare you, they're to motivate action. Knowing the risk should override hesitation. Don't ignore the warning. Act now to protect your brain. The evidence is clear, fast action saves lives. Don't sleep through the alarm. If you or someone else has sudden numbness, weakness, vision loss, or trouble speaking, act immediately. Call emergency services. Don't wait to see if symptoms go away. Paramedics can start care on the way and get you to the right hospital. Never drive yourself. Symptoms can worsen suddenly. In the ER, tell doctors exactly when symptoms started. Timing is critical for treatment. Describe all symptoms, even if they've resolved. Share your medical history and medications. Expect urgent tests, brain scans, blood work, heart rhythm checks. Treatment may start right away to prevent a future stroke. Fast action gives you the best chance for recovery. A TIA is a wake-up call and a second chance. Prevention starts immediately and lasts a lifetime. Medications are key antiplatelets like aspirin or anticoagulants for certain heart conditions. Managing blood pressure, cholesterol, and diabetes is essential. Take medications exactly as prescribed. Lifestyle changes matter. Eat a heart-healthy diet, exercise regularly, quit smoking, and limit alcohol. Maintain a healthy weight and keep regular doctor visits. Prevention is a partnership. Stay engaged in your care. A TIA doesn't have to define your future. Act fast, follow medical advice, and commit to change. Share this knowledge. It could save a life. Recognize the signs, act quickly, and protect your brain.